So, welcome to module 2 of the Little Brushes Guide. We are going to talk about toothbrushes, particularly the electric toothbrushes. So, I would say initially, so the teething happens for milk teeth come through from the age of 5 to 6 months. So I recommend that as soon as the teeth come through, make sure that one of the biggest things you can do is make sure that you wipe the milk, either breast milk or formula milk, but definitely formula milk, off from the teeth, especially at night. So there are these dental cleaning wipes because you can't obviously brush a child's teeth. So just get a wipe and just get rid of this. There's these dental cleaning wipes which help get rid of the milk and the sugar from it efficiently, but even just use a flannel and wipe it off your teeth, just so that it's not staying on the teeth if possible after when the teeth are just coming through. As a routine for brushing, it's a good idea to use manual toothbrushes to start with. I recommend the finger toothbrushes because the children don't have a lot of head balancing capacity, so they are moving the head all around, so it's a good idea. So I recommend usually either putting the child on your lap and then brushing the teeth, or making sure that you use a two-person technique. So all these pictures I will try and put up a little later. Two-person technique where you sit the child on your lap and then you put the child down, so the head down, and then you can just use one person's lap when it's a small baby, but you might need more help as you proceed. The trick is to make brushing a fun activity. So make sure that you're, as a parent, are brushing along with the child, or you're showing the child when you're brushing and then you're also brushing their child. You can sort of count the teeth together, you can show them in the mirror, make it a bath time routine, whatever it takes. It should be a fun activity. Don't be too quick at introducing toothpaste. So start with a manual toothbrush or finger toothbrush, so that it's just a slow little process of just cleaning where there's only one or two teeth. So start with that, and then slowly as you get more teeth, maybe again, every child's different. I would say, making sure that you give at least 1 or 2 or 3 months of using a finger toothbrush. Introduce toothpaste, and you want to introduce a toothpaste that is either like a bubblegum flavor. There are lots of options. I have mentioned it, we'll come to that in a second, in one of the modules. So use a little bit of the toothpaste again, and don't overwhelm the child, and see if that's something to their liking, and only then start using toothpaste regularly. The other thing is that, children really respond well to mimicking the parents rather than listening to the parents. So remember that. Always try and show them the brushing that you do, because usually you probably want to have your own time. It's a good idea to introduce them to something that you do, and you take your time and you look in the mirror and show them that you look in the mirror. Maybe they can look in your mouth, and just sort of cultivate a good feeling for the oral hygiene, and it's not something that you tell them to do and they have to do. So these are things that I have made mistakes on, and that's why as a dentist I was so paranoid about the brushing, and I think that at some point that I've overdone it and been too much. So again, all these are tips and tricks that I have also learned as mistakes from what I did. So toothbrushes. So let's come to the toothbrushes for newborn babies. Again, for anybody, not just me, it is my personal opinion as well, but evidence says that electric toothbrushes are much better than a manual toothbrush for children, adults, everybody. So we are talking about BIs. So that's the dental cleaning wipes I was talking to you about. So use a dental cleaning wipe to clean the milk off the teeth. And it's also essential to get a routine. So I recommend a starter kit. So starter kit has got the finger toothbrush to first start with, and then much softer manual toothbrush that you can sort of help, let the baby brush a little bit. You've always got to help them. We have to help children brush their teeth till their manual dexterity is so that they can tie a shoelace or write their name clearly, basically enough manual dexterity. So every child is different, usually about the age of 6 to 7 they say, but to be honest, even adults can't brush their teeth properly. So imagine a child who's 7 years old, they don't know how to brush their teeth properly. So as parents, the more you can help with your busy schedules and children's busy schedules, do try and help them with their brushing. So the first thing is a starter kit that goes of 2 different ages, and then try and introduce an electric toothbrush as early as they would allow. So I would say about 3 months of brushing with a manual toothbrush. Like, again, every child is different. Start with a battery operated one. So battery operated is one where you put different types of AA or AAA batteries into the toothbrush. They have much lesser vibration, so it's easier on the child to get used to it. I don't like those battery operated ones. One is because the vibrations are about, I think, 16,000 strokes per minute. But the problem with that is that as the battery starts running out, those vibrations don't last like that, and we won't know about it until it goes off. So I'm not a great fan of it, but it's a great introductory toothbrush. So I've given a couple of options of different battery operated toothbrushes. It's a good idea to sort of, help the child pick their brush, make it a big deal about picking the brush and using the brush. And, when the siblings come home, the other parent come home, it's like, oh, you've grown up and you've got your new adult, electric toothbrush, and all of that is just making big deals about things that are important always stays with the child. So that's, again, just a mom opinion. The myth buster mentioned here, that is an electric toothbrush is a marketing gimmick. It's not. It's very, very, very well evidence-based. So that's about that. Toothbrushes for 3 to 6 years. So yeah, it's ideal to start using, even if it's a battery operated one, you can use it, but then move on to an electric one. That means the one that you charge up. Strongly recommend an electric toothbrush for children, especially from the ages of 3 to 6 years. If we stop decay during these years, then we are heading in a very good direction. So it's a good idea because, again, children at this age do like their chocolates and sweets, and so it is a really good idea to try and make sure that they don't get any decay on their milk teeth. So the toothbrush I used for Izan, and then I used for Hadi as well, as the Oral-B Pro Kids series of toothbrushes. I think we went through 2 lots of toothbrushes, and then once they got their adult teeth, we moved on to Oral-B Pro 3, and that's what they're using now. So the only type of toothbrushes that I recommend is an oscillation rotation toothbrush that goes back and forth like that. The only Oral-B has got a patented technology that has got an oscillation rotation toothbrush head. All the other toothbrushes in the market are sonic toothbrushes. There are a few other different types like ultrasonic, laser. There's a U-shaped toothbrushes. If you have a U-shaped toothbrush, throw it in the bin right now. They are really useless and they don't do anything for removing plaque. I will be going through toothbrushes again in another module, but what you need is the electric toothbrushes are mostly of 2 types: the oscillation rotation toothbrushes, as the Oral-B, and then the Philips Sonicare toothbrushes, which is a sonic vibration toothbrush. The patency ran out about, I think, 4 years ago, and so when their patency ran out, any company that has got either some electronic or any healthcare, all of them started producing an electric toothbrush to get a chunk of the money, and there are so many out there. If you do like a particular sonic toothbrush, you can use it, but just remember there is a different technique for manual toothbrush, there's a different technique for oscillation rotation toothbrush, and a different technique for Sonicare toothbrushes. All the techniques are there on my YouTube for free, but I will be going through all of those in another module. So the only Sonicare toothbrush that I recommend for any age is this Philips Sonicare for children. Why I love it is that it's got an app. So you can show the children the app. The app's really, really good. I've just seen videos of it where it tells where you brushed, how long you brushed for, so the parents can keep an eye on it. And for that reason, I quite like the Sonicare toothbrush, and that might be my only recommendation for a Sonicare toothbrush. Now, the most crucial time is the mixed dentition period. Mixed dentition period is when the children's milk teeth are becoming loose and wanting to fall out and exfoliate, and the newly erupting adult teeth are coming into the mouth. Newly erupting adult teeth, usually the first ones to come is your first molars, one of the most important teeth in the mouth, and your upper and lower central incisors, again one of the most important teeth in the mouth. And it's coming into a mouth of at a delicate time, 6 years, and children don't know how to brush their teeth properly, but parents think they're old enough to brush that by themselves. They've got started getting adult teeth. Teeth don't come in straight, they're not easy to clean. Adult teeth are much harder to clean than milk teeth, and thus can start downhill. So it's a really good idea to keep on top of it. Efficient brushing is usually poor during these time. One is because the mouth is sore because you got loose teeth. When you've got loose teeth, it's quite sore. Or erupting teeth, that's also quite sore. Children usually brush unsupervised from the age of 7, which we don't think is a great idea. Children can have braces for crooked teeth. Crooked teeth in itself is a problem, and on top of that, if you have going to put them onto braces, you really have to make sure that they are well looked after. Adult teeth are uneven and it's not as easy to clean, so you need to take more time with the brushing. Children usually consider brushing as a time-wasting activity, so which is again that's what a lot of people think, but especially children. And they sort of think they can lie, oh yeah, I brush my teeth, when they have touched the toothbrush and the toothpaste or not even done that. They typically have a high sugar intake, so they've got very high chance of decay establishing, and once decay is established, it's really hard to get the children out of it. And also another is that children become very independent. They start getting their own tuck money or snack money, or they can choose what they want. They're a bit more independent, and so for those reasons, again, their choice of food and higher sugary content food can be high. As soon as the adult teeth come into the mouth, that means from the age of 6, I would recommend that they use adult toothbrush and toothpaste. Now, my most common recommendations for everybody is, as a budget toothbrush, is an Oral-B Pro 3 series. It's a very good toothbrush with a brush head, which we will discuss later. And the best in the market is, I have said Oral-B IO9, but there is also an Oral-B IO10. IO10 is the latest one, and the best thing about that, so the Oral-B IO9, you have to check an app to see, it tells you where you brush, how long you brush for, where you missed, all of that. It's a really good app. That's what I have, and that's what I use now, and I love the toothbrush. It's got a separate tongue cleaning setting, which I love as well. But the Oral-B 10, it shows directly on the dial how long you brushed and all of those data, which is quite useful. So, but I have mentioned Oral-B 10 as well. And then I have mentioned Oral-B Vitality because it's not the greatest toothbrush. It's a lot more cheaper, but what you can do is you can introduce the child with an Oral-B Vitality. And also I understand that there's a lot of countries that does not have the Pro 3, so that's why I have put a Vitality on there. But if you can get hold of Pro 3, that would be my suggestion. Now, for brush heads, it is recommended that the brush heads are changed every 3 to 4 months, because what happens is we won't see it, but they have these minute splays, or like how you have split ends on your hair, same way it splits, and then it doesn't clean properly, but it also can cause damage on the gums and on the teeth as well. So we don't want old brush heads to be used, so making sure that children change their brush heads every 3 to 4 months. There are quite a few different brush heads. So there's a precision brush head, which is perfect for anyone who does not like the cross action. Cross action is the most ideal. So let's talk about the cross action first. The most ideal toothbrush head for Oral-B is the cross action one. It has got bristles so there is evidence to show that bristles of different angles and different lengths brush better, because our mouth's not straight, so we want different angles and different lengths to give a good efficient brushing. And that's what the cross-action brush head is. And so if you can get used to it, that's what my suggestion would be. If you wanted a little bit more of a smoother, that's a bit more of a, not a harder brush, but a bit more of a vibration. You can feel it a bit more. So if you want to try a precision toothbrush, you can do. Floss action is they've got these long little rubbery bits that flap around. The advantage of that is like people who got like gum disease or people who got more prone to the gum recession. There are big gaps in between the teeth. Though for those people, I would recommend the floss action brush. This interspace brush head is just brilliant. So it is really good for when, you know, just a new teeth, just one of the heads come on. You can just clean that, especially when the adult first molars come through. Cleaning that properly, or like if there's one tooth that's a slightly, like especially the lower incisors, they come in tipping inward, and sometimes really hard to get on the inside of it. So just, you know, just getting just on the inside, just onto the tooth there, or in between the teeth, or if there's one tooth that's sliding back and you can't get to the back of it. This has just got 3 tufts, and it's a brilliant toothbrush to have. And especially if you have like braces, or if you got a wisdom teeth that's not come through, or there's some one area you can't, this brush head is just a brilliant addition to your kit. All the above mentioned brush heads don't go with the Oral-B IO. That's just for normal Oral-B. And for the Oral-B IO, there's only one type of brush head as a regular, which is the ultimate clean brush head. And there's a specialized brush head that is similar to the interspace brush, the 3-tufted brush, which again I do recommend that everybody has. So that's all about the electric toothbrushes. I shall do another video for manual toothbrushes. So I shall see you in module 3. See you soon.